Dr. Freedman's work. Dr. Freedman has a PhD and a MPH, a Master's of Public Health, and is an applied population health scientist and a community psychologist. So it was in 2019 here that Dr. Freedman was appointed a Swetland Professor of Environmental Health Sciences in the School of Medicine at Case Western University. So Dr. Freedman is joining us from up north a little bit here in Ohio, where she also serves as director of the Mary Ann Swetland Center for Environmental Health. Dr. Freedman has an extensive community engaged research portfolio and just really epitomizes the ideals of authentic community engagement, in my humble opinion, and really a strong history of working hand in hand with community partners around food systems work, and working with those stakeholders to develop, test, and disseminate policy and systems level interventions to promote health equity. Of importance here is that these interventions are designed to address that complex interplay between public health and the health environment. So I also want to highlight that Dr. Freedman walks the talk and serves the local community in her role on the steering committees for both the Cleveland, Cuyahoga County Food Policy Coalition and the Ohio Nutrition Incentive Network. So wearing a lot of hats in the community. So, thank you for joining us today, Dr. Freedman, for taking some of your time to be with us. And thanks to all of you who are joining this seminar. I think it's going to be really engaging. One thing I want to highlight here, we are recording. Also, Dr. Freedman has asked that if you have questions, key clarifying questions, you could certainly ask those in between slide transitions, but to save the majority of substantive questions toward the end of the presentation, and certainly there will be time for Q&A. So thanks again for being here, and at this point I'm going to turn it over to you, Dr. Freedman.
Great. Well, thank you so much. I'm going to go ahead and pull up my slides here, and there we go. Yes, so thank you, Jennifer, for that warm welcome and for the opportunity to present here with the Glenn College Colloquium series. I also would like to thank other members I know of your planning committee, Jill Clark, Stephanie Moulton, and Alan Matthew, for your support in helping me organize the talk today. As you can see in the title of the talk, Creating a Culture of Nutrition Equity, there's a lot of words in here. I think the second part of it, moving ideas into action for food justice, leans into a lot of what I learned, and I've learned for a long time, but really became clear when I was became the director of the Swetland Center in 2019, that our community partners and stakeholders were interested in really moving beyond defining environmental health problems like air pollution and food system problems, lead issues, to looking at spaces of solution and spaces of action. And so you're going to hear, almost a decade's worth of work. We're not going to go through all the parts of that, high level snapshots of how did we start to think about moving ideas into action for food justice related to food systems change. I did want to highlight here, if you are on Twitter, or you can follow me or the Swetland Center here. So like Jennifer said, I'm coming from Cleveland. I always think it's nice to ground a little bit in the place where I'm coming from. So for those of you who've never been to Cleveland, or those of you that are from Cleveland, you probably know our West Side Market. It's one of my favorite food spaces in Cleveland. It's an amazing, centuries old, it's founded in 1840, public market space. And actually recently, for those of you in the Glenn School, I think with your interest around public policy, is recently shifting leadership from being run by the city to being run by a nonprofit. So if you're ever in the Cleveland area, make sure you stop by, pick up a pierogi or one of the best pastries you'll ever try, or any number of other things, fresh pasta or bacon. This is definitely a place to visit. There's also fruits and vegetables on the outside walls. So my presentation today, I'm going to begin with a primer to talk a little bit about ground our conversation and how do we think about complex systems, because my talk is ultimately about systems change. And I guess I'll spill the beans to say that, if we're going to move any kind of action forward related to food justice, I think that we have to be talking about how we change the system. We can tinker around the edges all we want, but if we don't change the goals of the system, I don't see food justice as an outcome. Secondly, I'll be talking and grounding us in what the problem is. So why do we need food systems change? We'll then move into the process. So how can a systems model of nutrition equity serve as a compass for food systems transformation? And then lastly, I'll give you a sneak peek into how we've taken all of these ideas and planned a system level intervention focused on nutrition equity, and actually started to implement that intervention earlier this summer here in Cleveland. So you can see another picture, again, grounding you in Cleveland, Cuyahoga River. And I use this picture of a bridge here because a lot of times in systems, we're thinking about connectivity and accelerators or decelerators of change. And in other cases, we're thinking about how do we create linkages. This is a bridge that's up and, things that are happening on the left side are not able to connect on the right. But when that bridge lowers, the whole system is going to operate quite differently. So moving into our primer, how do we think about complex systems? Before we get started, I want you all, if you have paper and pencil, go ahead and do this on your own, but just to sort of put a dot in the middle of the paper. And ideally, it's a paper that doesn't have anything else on it. So there's a bunch of white space and a dot in the middle. And if you think about it and look at it, and if you're online, you can even add to the chat, like, what do you see in this picture right here? What's standing out to you in the picture? Maybe somebody could put something in the chat. Right, so people are seeing a lot of the blank spaces, the areas where there's really nothing there and it's not really clear. Seeing solidarity of this sole lone dot really centered in the middle. And so as we go through this presentation, hopefully we'll get a better sense of both what this dot is, but also what is this surrounding space? What are the things that sometimes we cannot easily see that are going to shape the environment and shape opportunities for what's happening? When we think about complex systems, there are some characteristics. So complex systems are dynamic, which means they're changing, and they're adaptive. They're non-linear and stochastic. Stochastic means that they're random in terms of how they act rather than a deterministic or sort of a predictive model. There are interrelations among different sets of action within the system, and they create feedback. There are time delays between cause and effect. And there's also this idea of emergence. So there are things that sort of bubble up out of a system that it's not, you've probably heard the phrase, a system's more than the sum of its parts. And that's kind of getting at that emergence property. And another side of emergence is that it can also produce unintended consequences. Sometimes these are good, sometimes these are not desired consequences of the system. And when we think about systems, sometimes it can feel really big and really complex. But the reality is that systems can behave in common ways. And one of the terms that we use in system science to talk about these common ways are system archetypes. And so in this slide here, you can see two different archetypes. There are a number of different archetypes. One here on the left called fixes that fail, and another one, success to the successful. These are two archetypes that have been particularly helpful for our team in thinking about food systems change. So fixes that fail, I'll just play it out with an example that maybe you can relate to. So in this example, what you can see again is feedback. So, these loops that are connected. S means that things are moving in the same direction. O means they're moving in the opposite direction. So here I have a problem symptom, I have a backache. And because I have a backache, the more my back aches, the more motivated I might be to get a fix. And my fix, maybe it's a standing desk. And the more I get my standing desk, use my standing desk, maybe, less opposite, my back might be aching. But it could also produce an unintended consequence because because I can stand at my desk, I actually can spend more time working. And the more time that I'm working, whether I'm sitting at my desk or standing at my desk, it still could cause a backache. And so in this example, my fix, the standing desk, did not really get at what maybe was the root of the problem. And maybe in this case, I'm just working too much and I needed to find other ways to get out of work, to not only relieve my backache, but maybe I'd have other kinds of benefits. Another example is the success to the successful. We see this play out all the time. Here's an example. In the middle, you can see allocation to A instead of B. So let's just imagine that we're allocating time for research. And I'm giving examples kind of related to academia because I felt like maybe folks could relate to that. So here, allocation of time for research. If I have more time, I might be able to get more funding. And if I have more funding, maybe I'm going to get some more publications. And then more publications I have, now people are saying, oh, yeah, let's give you some more time to do research because it seems like when we gave you time, it's really successful. And on the other hand, I give less time for research for some people and that they have less time, so they're less able to secure additional funding and less able to publish results of their research. And, when it comes back for evaluating who should have time for research, I'm much more likely to give time to the one that was already successful than for the one on the other side who didn't seem to be, bearing the fruits of the research market. And so, another thing related to systems is that there are levels to intervene in a system. So here's a model created by Donella Meadows. I actually pulled this, although I've seen this in many other places, but I saw it recently in this paper in 2019. I want to give them the acknowledgement. But basically what you can see in this figure is on the left side, it says increasing effectiveness to create system-wide changes and immutability of the leverage points. So the farther you go down, the deeper the leverage. And at the top are the more shallow leverages or the less effective at creating system level change. And on the right side, you can see that these are broken up into four main types of system change. So we can change the intent of the system, the design of the system, we can change feedback within a system, and then we can change parameters within the system. And again, I'm going to just bring it back to an example that many of you may be able to relate to. And starting at the bottom, again, the deepest leverage for change, I can change the culture for, maybe I'm really trying to change the culture to value and set goals and sort of align worldviews of actors within the system around diversity, equity, inclusion. And I want to create this culture. If I create this culture, all of these other things are much more likely to stick. But let's start at the other end. This is oftentimes how we go about creating change. We're going to change parameters. So what I'm going to do is I'm going to create a diversity training. At Case Western, we call it Diversity 360. Everybody has to go through Diversity 360. Just by changing that parameter, the number of people who've taken a training on diversity, equity, and inclusion, if I don't have this DEI culture, its ability to affect change is quite low within the system. And then you can kind of move up from there. It's good to have a training, but do we have any kind of commitment for DEI within faculty searches? And then even further, let's imagine that we actually do have this commitment and we bring in diverse faculty, but is there any DEI criteria within our tenure and promotion system that values the contributions made that might be unique and different and exciting in different ways within the system. So this is just an example. Again, your highest leverage is going to be at the level of culture. And oftentimes the changes that we're implementing tend to be more at the parameter level change. In the food system, this may be, creating one more farmers market in a neighborhood, or getting, one more dollar in the SNAP benefit. As soon as that dollar goes away, I'm back to the same place. I haven't changed anything else in the system to address the reason why I might not need a SNAP benefit in the first place. So I want to pause there because, I think there was a request to sort of pause at points for any questions. So any questions about thinking in systems? And Jennifer, you could maybe help me if there are any questions.
Yeah, happy to. Any in the room? I'm not seeing any in the chat either. I think you've been incredibly clear and helpful.
Okay.
Thank you.
Great. So the next thing that I want to shift into is really looking at the problem. And here I'm going to kind of lean in a bit more into our focus area on food systems. So why is systems change needed? And I'm only going to give a couple of examples because I can, like I said earlier, what we've heard, we could talk forever about the problems, but really thinking more about solutions. So, I want to remind us all, this is a quote by Deming, one of the sort of grandfathers of systems thinking. And he says, every system is perfectly designed to get the result that it does. So our systems have goals. And the things that we see produced by the system are really, they're exactly what we're hoping to get. So here's an example. This is looking at food insecurity trends in the United States. Those of you that follow these trends, just notice the latest data came out from the USDA, and I've included those latest data over here. So basically, in system science, we look at trend lines. We're trying to understand what is causing something to go up or go down, or where is its level of homeostasis, or where does the system balance? And what we can see here, in the title, for the past 2 decades, Black and Hispanic households have been twice as likely to experience food insecurity than white households. So what we can see, and you can look at this over time, if you go back to 2001, in the light blue, you can see for white non-Hispanic households, the dashed line is for overall, and then the dark blue line is for Black non-Hispanic households. And I just put in these 3 to keep it a little bit simpler to read. But you can see, almost 20 years ago, about 21% of Black households were food insecure, just under 11% overall, and about 7.5% of white households were food insecure. Jump, 20 years later, we have about, we actually do have a slight decline in African-American from 2020 to 2021, which is good news. But again, not a huge difference in food insecurity by Black race overall or by white race. And so what this tells us is really 2 things. I mean, one is that this behavior of the system has been resistant to change. I mean, there have been things that have pushed it up. You can look here, the Great Recession of the 2000s, when we saw the mortgage crisis, that definitely pushed the system up, and we kind of were seeing some declines. And we saw even with COVID, that there were some boosts up here, particularly for Black and Hispanic households. So one, we're seeing, kind of our system hovers around 1 out of 10 Americans being food insecure, and about 2 out of 10 African Americans being food insecure. And that we see that overall, there's about 3 times more food insecurity for African Americans compared to whites. So we see the clear racial patterning of food insecurity. And here's another way to look at it. We know that the foods that we eat have a major impact on our health. And so this is a study, we actually published this earlier this summer, and it's looking at the prevalence of cardiometabolic health indicators across the homeowners loan corporation grade. So, these are the D grade is the red line grade. So this would be the worst grade, the A, the green line grade, the best. And, these are coming from the 1930s. Many of you have heard, and OSU definitely was a big leader, and with the Kirwan Institute putting out are helping us understand the legacy of these policies and disinvestment in racialized neighborhoods on a variety of outcomes. But this is just looking at health outcomes. I mean, you really couldn't see more clear trends. So for almost every single, except for high cholesterol, there's a clear gradient that D line neighborhoods do worse than all of their peers. But there's also a gradient that green does better than blue, blue does better than yellow, and yellow does better than red. So I like to give this example as well, because it helps us see that the system, like for food insecurity, sometimes we can think that this is an individual level problem. And these data help us see that these are very much structured by a broader system that is shaping opportunity to not only access foods, but also the health implications of that embodiment. So I'm going to pause there and see if you have any questions about the problem.
I sort of have a question. It's a bit broad, but just in the sense, obviously there's a lot of motivation now as to why we think of systems. Could you speak a little to the failures of, for example, like smaller scale efforts to change this, and why more often than not, they tend to fail or not have that deep impact that we're looking for?
And when you say smaller scale efforts, are you saying along the continuum of the levels to intervene in a system, or what do you mean by smaller scale efforts?
I suppose broadly, just as opposed to thinking like a systems level change, or when you're trying to start a project that is trying to change culture overall versus a project that's trying to change a parameter, as I think that hierarchy you showed earlier depicted.
Yeah. Well, I mean, I think the culture definitely influences why we go more toward parameter change and less toward broad scale culture change. I mean, one of them is that we often, we said that one of the sort of truisms of systems is that there are time delays. And so when we focus on parameter change, a lot of times, we're like, what could you do in 3 years? What can you do in 12 months? And so the ways that we create reward structure in the system, like, for example, being able to get a grant, whether you're in an academic space or a community space, if you can get so many pounds of food out within 12 months, we're going to reward you for that. So I think, the way that the system is structured, it looks at very short-term ahistorical views about how the world works and how we create change. And so I think that there's so much inertia around just living up to that, to those goals of the system as it is right now. So not to say any of those things are easy to do. Starting one grocery store, as you'll hear in a minute, starting one food hub in a neighborhood is extremely expensive and it's very complicated. But it's just not looking at those broader of like, why is it that we do not have healthy food retail in racialized neighborhoods throughout the United States? What is it about the way that we operate as a society that causes that to happen? That's not a chance thing. And what would it mean to undo that? I mean, I know you all are probably very involved in work around racial equity and diversity, equity, inclusion at a minimum in your university setting and your organizational settings. And so these are very difficult things to change, because it means that the system is designed to achieve the goals it achieves, is saying we want to achieve different goals. Some people could feel very threatened by whatever the new goals are, because they may feel like they're missing out, that their goals are no longer going to be able to be achieved. So I mean, it's not to say that going up high, it's deep and important, but it's very hard. It takes a huge amount of buy-in, and it's not the same kind of change as, creating one new farmer's market in a neighborhood. I mean, there's no way we can create culture change just as a unit of one, right? We have to be linking together across multiple other groups to create culture change.
Thank you.
So, that's a good segue into thinking about, well, how do we create a systems model of nutrition equity? And how did we start to build out a framework for thinking about systems change related to food justice? So I'm going to tell you a little bit about how we got here. As I said earlier, and this is decade long. And if you took all of the partners that are in the room that were involved in this process, they all probably about decades more. I mean, this is about collective wisdom and feedback and engagement and listening and learning together that are sort of the culminating in what I'm presenting today. So one of the big motivators for the work that we did in 2015, we received a grant from the National Institute of Diabetes, Digestive, and Kidney Diseases. And in that grant, it was an external evaluation of a food hub that was being developed in the St. Clair Superior neighborhood here in Cleveland. And it was actually called Hub 55. You can see on the left-hand side, the renderings of what would become the food hub. And then on the bottom is actually a picture of one of the components of the hub, which was a cafe, a healthy cafe. And you can see, I'm not going to go into all of the details. I mean, the fact that we received the grant is an indicator that this was perceived as being extremely novel. It was a combination of a physical food environment intervention with social components to build community engagement and community organizing in the process. It also had a jobs creation space. The project itself was funded by a Healthy Food Financing Initiative and also by a supplementary grant to the Kresge Foundation. So the project was run by a community development corporation. We as researchers were externally evaluating it. And actually our comparison community for this quasi-experimental study was in Columbus in the South Side neighborhood. So you can see by the title, small improvements in an urban food environment resulted in no changes in diet among residents. And, this was really surprising for us in many ways. It's like, wow, here's this healthy food financing funded initiative. This is huge federal policy. We're looking toward this as one of the ways to solve issues around lack of access to healthy foods in communities. And we started to look at all the literature. What were the results of these HFFI funded projects? And you can see going down the list, food hubs, grocery stores, there really were not a lot of positive changes in the outcomes that they proclaimed they would change around diet, around perceptions of the food environment, a little bit of change in perceptions. And could be because of those time delays that we needed more time to evaluate it. But what we saw in our study is that we weren't really studying what was happening in this food hub intervention. So we were treating it like a traditional kind of linear model of change, that there was going to be, one more unit of food hub entering the community. We were not looking at any interdependencies between the food hub and other interventions of the context. And we weren't looking at all the other things happening there. So for example, we weren't taking into account that the food bank was giving away a bunch of produce, pallets upon pallets of produce next door to the corner store that was trying to sell fruit cups. And then the pallets of produce would just sit there and rot. And then the corner store owner is saying, hey, what's going on here? I'm trying to change what I'm stocking. And all people see when they walk by is like thousands of pounds of rotten produce sitting outside my door. Why on earth would they ever come in here and spend $1.99 on a fruit cup? In addition, we were not studying power relations and resource management. we were not privy to the negotiations between the public and private partners of the food hub. And long story short, that food hub ended up going into foreclosure. We didn't understand the capital development and control, and we were not involved in measuring how the project was managed and how people's capacity was being enhanced to run this model. What we were studying really, really well with the best methods possible was diet quality. We were looking at objective food environments, perceived food environments, and food insecurity. And so it caused our team to sort of sit back and say, what do we do from here? This was something we felt excited about, and it was just almost like a disaster on every front. And I think that's an important lesson as researchers, to be able to document. Sometimes we only hear the success stories. And so we started to say, how do we try and better understand what this system is, and where are there opportunities to think about change? And so in 2018, our team was awarded a grant from the Foundation for Food and Agriculture Research to start the Modeling the Future of Food in Your Neighborhood study. And this study had the end goal to develop credible and relevant decision support tools to offer a systems lens within an equity framework to guide future sustainable local food system development. So in many ways, I call this study a thinking study. Our prior study, Food Nest 1.0, was sort of an observational study. This is really a thinking study. And the methodology that we used for our thinking was participatory system dynamic modeling. And this is an approach to try and understand the system. And we do it using a collaborative, engaged methodology. And as you can see, I know many of you have seen this figure before, we all are touching different parts of the elephant. And when we're all touching different parts of the system, and we need to be able to come together and realize that actually the tail and the trunk are part of the same thing. They feel different, they look different, but they are actually connected. And we need to try and understand how we make those connections. So we followed the community-based system dynamic modeling methods that Dr. Peter Hoffman, who's actually a faculty member here at CASE, developed. And some of the things that we took into account was the idea of co-creating models. We were focusing on multiple sources of information to guide model development. So we were really expanding the notion of data and information resources. It was very interactive and an iterative mapping process, trying to understand the structure of the system as well as the behavior. What does it produce? We were looking at feedback mechanisms, and we were exploring these time delays between cause and effect. So how long would it take before we start to see these kinds of outcomes? And then lastly, as in almost all systems work, we're trying to see, where were these points of leverage for transformation? So this is a picture of our team. We were a community academic research team. We met for about 3.5 years doing our modeling work. And we started, again, pre-COVID. So we did a lot of our work online, but we continued that during COVID, and we did modeling workshops even on Zoom for the last part of the study. So our study, as a community engaged collaboration, we had some values and assumptions that guided our work. We acknowledged that every system is perfectly designed to achieve the results it achieves. We said that we see systems change as being both possible and requiring collective understanding of complexity, connections, and dynamics. And I think this one, to the question earlier, sometimes why do we do parameter level changes? Because we're like, we can never change the system. We believe that the food system requires engagement from a range of stakeholders that all had a place at the table. We assume that trust would be a catalyst to systems change, and collaboration and transparency was needed to build trust. And so we did a lot of work in sort of, how do we co-create this model so everybody can understand what's under the hood? We focused on equity in both our process of how we work together, as well as the outcome. What was our hope with the work that we're doing? And we sort of believe that our work should allow for illumination of existing injustices of the system, but also provide guidance for redressing these. And then lastly, the work was iterative and adaptive, and it was always open for deliberation. It's definitely a living process, and what I'm presenting today is sort of a conversation piece. Definitely, there's opportunities to continue to refine and adapt. So we published our systems modeling work in the American Journal of Clinical Nutrition earlier this year in a paper called Food System Dynamics: Structuring Nutrition Equity in Racialized Urban Neighborhoods. And you can see here a little bit about our methods. So we had a core modeling team. You were seeing some of the photos of that group. It was a total of about 10 academics, very transdisciplinary, and 20 community collaborators. We then had a number of different data sources. So we did 20 interactive workshops. With the core modeling team, we followed a series of scripts that are commonly used in system dynamic modeling. We also did key informant interviews with 3 different stakeholder groups: residents, food retailers, and regulators of the system. And then we held 6 public workshops to get additional feedback on the modeling work that we were doing. In terms of our analysis, we used this iterative and deliberative and analytic approach. We did qualitative coding of the data. So the interview data, we did inductive coding, as well as we used that to do deductive. We also coded the interview data using deductive methods based on some of the feedback we were getting from our causal loop diagramming from our systems modeling. We translated all of the data into what we call causal loop diagrams. So you saw that in Success of the Successful or Fixes That Fail, these feedback loops. We were trying to understand what were the reinforcing loops. So where were the accelerators of growth or decline in the system? And then the balancing loops, where were the spaces that were sort of pulling the system back into homeostasis? And as you can see in these photos, I mean, we're talking about a lot of complex things, but we did pictures and dot voting and drawing and discussion, throughout the process. So moving into our findings, one of the things you're always looking at, and I showed you some trend lines earlier of the problem, is you're trying to understand trend lines, and you're as a group looking at how do you see this trend going forward. So looking into the future, what is your hope for the trend, and then what's your fear? And we're trying to understand what are the dynamics that would cause your hope line to occur, and what are the dynamics that we're drawing actually in line with what we think is the fear line. So when we started to think about these reference modes that we would, that are important to map as we think about food justice and local food systems, there were these 3 indicators that came up. One being economic opportunity. So do residents have sufficient financial resources to freely meet basic needs? 2, food insecurity or food security. Can residents consistently meet household food needs with dignity? And then 3rd, fair access to fresh and healthy foods. Is there quality and affordable food supply aligned with consumer demand so people can get the foods that they want? And we also found this emergent dimension within our modeling work. And early on in the modeling, we did a lot of, you saw, we were basically doing 2D modeling, and we would say, there's something up here. It seems like it's above the model, and we couldn't really figure out where it was and how it would fit. And ultimately, we identified this emergent property of nutrition equity. And you can see that nutrition equity is sort of an amalgam of these 3 reference modes: food security, fair access, and economic opportunity. And we defined it through our collaborative process as having freedom, agency, and dignity in food traditions, resulting in people and communities healthy in body, mind, and spirit. And all of these words, freedom, agency, and dignity, food traditions, healthy body, mind, spirit. I mean, these were things that we talked about a lot in our project about the importance of language and narrative. And even something like body, mind, and spirit. Early on in our modeling, we had a variable in the model called chronic disease. And our partners pushed to say that that is not all that matters. I might not have diabetes, but I might not be healthy in mind or healthy in spirit. And that's really not about holistic health. And so we included that language in our definition. So when we asked our partners, qualitatively to talk about the food system, I love this quote from one of the residents. They said, what makes a healthy food system that's kind of hard to even single out because it's so many pieces. And, here's our model, our causal loop diagram. And don't worry if this looks like a bunch of mess and a bunch of lines going everywhere. We're not going to go into the details on here. I do want to highlight that in modeling and systems modeling, because systems are so big, you're always drawing a boundary on the modeling work. And it might take a minute to figure out what your boundary is. And then once you've drawn that line, you're really thinking about endogenous, so things that are within that boundary, and exogenous, things that are outside of the boundary of your system model. So the things that are in red here are the things that are exogenous. These are things that our partner said they are important and they influence the way that this system works, but we did not examine all of the factors that influence the dynamics of these, like the dynamics of neighborhood crisis, or the dynamics of other household costs, like what's shaping housing costs or SNAP funding. But basically what this is saying is that if SNAP funding changes, for example, if there's more SNAP funding, it's going to have an impact on the system as a whole. And if there's less SNAP funding, it's going to have an impact on the system as a whole. And as we started to do the work as a team and think about the major insights from our modeling research, we came back to these levels to intervene in the system. And this is another version of the Meadows map. But basically you can see, at the very top, changing the intent, changing the goals, our work very much aligned that in order to change the system, we needed to change the goals. And what we defined as the goal was nutrition equity, that systems change within racialized urban neighborhoods needs to set this North Star goal of promoting freedom, agency, and dignity in food traditions, resulting in people and communities healthy in body, mind, and spirit. And when we started to dig deeper into what are the domains of feedback shaping nutrition equity, we identified 3. So we identified feedback related to meeting basic food needs with dignity, supply and demand for fresh and healthy foods, and community empowerment and food sovereignty. And I'm going to go into these in a little bit more detail. So in domain 1, meeting basic food needs with dignity, what you can see here, again, this is an example of feedback loops. And you follow the arrows to understand the way that the loop works. And you can see B means that it's a balancing loop. So it's kind of pulling you back to homeostasis. And then R would be like a reinforcing group. So these are going to cause things to go up or go down, with all other things sort of being held constant. So within this model here around basic food needs, there were 4 different sets of feedback around side hustle, government benefits, emergency food assistance, and stigma and stereotypes. And if you look at this is a very clean set of loops, and you'll see how the other ones are not quite as clean. And this is because we have 50 years of policies related to hunger within our country, related to meeting basic food needs, not necessarily with dignity, but and that's because at the end of the day, people have to eat. I mean, we can't just deny people food. People can survive without a house, they can survive without a job, they can survive without health insurance for a period of time, but you really can't go very long without food. And so, there are fairly structured mechanisms in place. And when we ask people to tell us, or we analyze the data and really tried to understand what are these feedback mechanisms, here at the quote at the bottom is an example of a resident telling us about side hustle. And she said, I don't know. They say, I do freelance work where I can, when it presents itself, but it's infrequent and far between. And the sales of my albums and my books and things like that hasn't done much to supplement our income either. So yeah, basically it's a struggle. So you can think about side hustles or this work in the invisible economy. It could be babysitting or cleaning or hair or beauty, where you're using that to meet your household food needs during times of struggle, yet their transitional and underground nature result in unstable flow of resources. But this can close the gap. I needed a little bit more food. I did some babysitting. I was able to get more food in the household. Now, if I stop babysitting, I'm going to be back where I started. Here's another one around stigma and stereotypes. And you can see with this loop, there's a delay here, meaning that there are resources available like emergency food assistance or even SNAP benefits, but stigma may delay receipt of the benefit. So here's a quote. I mean, those that can go to the food pantry, but choose not to because they don't want to be seen with the food on the bus for whatever reason. Or it could be a pride thing. And so here we can see that, the negative views about people and groups struggling to meet basic needs may delay access to that resource, and they may be food insecure longer than they would need to. So moving into domain 2 of balancing supply and demand, you can see this is a little bit messier. We're not nearly as clear, and we haven't had 50 years of organization. I think the White House conference hopefully will start to add some shape to this side of the model. But there are 3 different areas in here: healthy food retail, job security, and food culture and norms. So looking at food culture and norms, one of the participants said, people are so used to what they're used to, and it's easier to eat unhealthy because it tastes good. And so this is an example where you could have the ability to meet household food needs. Maybe you have a little bit of money available, but your willingness to pay is going to be influenced in part by the preferences. And if you don't like the food, then you may not be willing to to purchase that food for your household. This is something you can see, again, the delay, that it takes a long time to change our food preferences. And then lastly, in domain 3, community empowerment and food sovereignty, again, a lot of lines, and you can see these big circles. And one of the things that we found with this one in particular is it had the most potential to influence the system as a whole. And just as an example here, one of the feedback loops is around community power. And the quote says, I think community has all the control. I don't know if we utilize it to the best of our ability, but I think the community has all the control. If there's a food system of any sort that is in the community that doesn't work, I've seen communities stand up and say, we do not want this here like this. We don't like this. This doesn't work for us. This is not what we want. Anytime a community comes together and says that, whatever it is, has to go. And so this is the idea of collective power mobilized to sort of instigate change within a community. And another thing that we saw in here, kind of on an unintended consequence, is also this risk of gentrification. And I know you've probably heard of green gentrification, and where you bring in something like gardens or markets into a neighborhood, and then they all of a sudden signal that this is a place where we should be investing because it's about to gentrify. And so here's a quote, I saw all these other restaurants and healthy stuff that's coming to the neighborhood, and we pay attention to what's coming. So a lot of us that's awake, we pay attention. The bike lanes, we don't ride no bikes. Who is these for, okay? And so, I think the important insight here is that there are unintended consequences. And if we're not paying attention to these, we really risk that our thoughts of transformation actually, sort of go in the opposite direction of what our hope is. Within our team, our partners really pushed us to translate these insights into multiple formats. So we created this menu of actions for community-driven food systems change. We worked with a number of community leaders on a food systems change fellowship, and we created this vision board toolkit to support food systems change. Here's some example of one of our participants in the fellowship last year. We also did work to translate out for public consumption. So we held convenings with mayoral candidates in Cleveland last year, wrote an op-ed, really sort of calling the mayor, the new mayor, this was after the mayor is elected, to center food justice within their agenda. So in wrapping up, what did we learn? We learned, one, that we needed to create a culture of nutrition equity and setting that as a North Star goal to guide food systems work. And that culture change will influence how we do what we do, if you go back to that DEI example, and the outcomes. What is it that we're trying to achieve? We also identified that we need to be looking at multi-dimensional targets. We can't only be looking at food security. That's necessary, but maybe not sufficient, and similarly around health. And lastly, this idea of getting feedback through community-driven action. And we identified these 10 feedback mechanisms, but ultimately our findings were showing that the community needed to own the change, and the community needed to figure out how to, put into action these potential solutions. Actually, we were going to name the menu of actions, the menu of solutions. And our partner said, how do we know if they're actually solutions? They're just a set of actions. They could actually not be solutions for a specific community. So I'm going to pause because I could go on and tell you a little bit about our Nourishing Power study, where we translate that into action. But I wanted to make sure I open it up for any questions that you may have about the work that the research that we've been doing over the past many years. So I'll just open it up.
Thank you, Dr. Freedman. Lots of food for thought there. Pun not intended, but I know I have been getting some chats from students in my class, so I do think there are questions here. But actually, I see my colleague from over in Health and Rehab Sciences. Hi, Dr. Starkoff. Glad you could join.
Hi, thank you. Thank you, Dr. Freedman. I really appreciate that information. And I'm curious, when you talk about systems change, particularly food system change, have you done any work or considered doing anything with the school districts in terms of school lunch, school meals, things along that line?
So I mean, schools are another, they're very structured system. Within they're a system in and of themselves, and then of course they interact with a lot of other systems. I personally have not done a lot of work. In our menu of actions, there definitely are things suggested that would be within a school system. So for example, how do we get more culturally relevant food served within a system, a school system? What does that even mean? There's a whole bunch of things that would come into sourcing that kind of food, preparing that kind of food. Within our Nourishing Power study, which is sort of our translation of the models into an intervention, we have a theme in our new fellowship around sparking and expanding food justice for children and families. And we are hopeful that some people may apply to work on creating change within school systems related to food. But my own personal work has really not focused on the school system.
Great question. And we have a question here in the room, Dr. Milton.
Hi, Darcy. This is an excellent presentation. I have a quick question about, or I guess it's not quick, it's a complicated question, but it seems like a lot of what you're doing is reflecting structural inequalities that have been embedded in the system over decades. And so I'm thinking about, your redlining maps, for example. And so I'm thinking about structural wealth and income inequalities. And it seems like you guys are paying really good attention to that. I'm just wondering, I'm trying to think about, well, how does that if I know that it's caused because of these structural inequalities and wealth that have been created over decades, how do the solutions then, do you try to have solutions that address those gaps, or do you allow those, acknowledge those gaps exist and then work around them, or how do you think about that?
Yeah, great. Very good question. And I think a very important insight. So that's why we focus on nutrition equity as that goal. Because I think if we're not able to change the values that we have about expectations of the food system. So, we said a value of promoting freedom, agency, and dignity, and actually we've even modified it within the Nourishing Power study of freedom, hope, and dignity. So what do you do to achieve that goal? Well, you're going to do different kinds of things. And I think one of the challenges in systems work, because it's all connected, is to feel like overwhelmed, like, but we're doing food systems, and now you're talking about economic systems, which are absolutely foundational to food systems, but now we have to work with all other kind of people, and it's like, where do we even intervene? And I think that's the opportunity, but also the risk in this work. I think the opportunity in sort of bounding your system in some ways at least gives you a sense of like, there are things we can do without, not to say that we won't also need to change the way that economic structures work, but that we are going to need to partner with other groups. Like, we are also not the experts on that. I think though, if we are to change the culture, the way we think about economic structures, if they were really looking at freedom, agency, and dignity, or freedom, hope, and dignity, would also change. And so I think that's where like that higher leverage point, is potentially gives you an opportunity. But this is definitely not, this is not only a food system problem. And I've defined it within there. Those are, in some ways we've exogenized those, but those are influencing. We would need different partners to do the modeling work to try and figure that out though.
I think we'll do, for the sake of time, one more question. I see Maham has her hand raised, and then I do have an announcement to wrap up at the end. So thanks for everyone's attention and interest.
Thanks. Hi, Dr. Freedman. So you talked a little bit about the transdisciplinary nature of complex systems approach. And so I'm wondering just how you manage and encourage what seems to be epistemological and like methodological pluralism for the type of research that you do.
So I think that, I'm a community psychologist by training. And when I started my training, really the most important thing to me was doing participatory research. I really didn't care about the topic. And I landed in food because it was what community members were interested in. And I feel like we're kind of lucky in food because it is just inherently interdisciplinary. And it also is, literally everybody can speak about it. You didn't have to get a PhD to talk about food. And so I feel like it democratizes engagement because it's just a topic that's relevant to everybody, relevant to multiple disciplines. And at the same time, you heard me talk about values. It doesn't mean we all like sit around the table and everybody respects everybody and everybody knows how to engage together. We have to establish processes for working together and trying to figure out, we speak very different languages, even the words that you just used. I love those words, epistemology and methodology, but not everybody knows what that means. And so how do we break things down? Like one of our sort of norms in the group was like a jargon-free space. And so like being able to call people out, like, I don't know what that meant, and talk about it together. And I think the other is just when we met together, that it was about relationship building, community building. I don't think this work could have become the work that it is if we started on Zoom, for example. We had really built community together, spent time. So when COVID came in Zoom, when somebody in our team got COVID for the first time, the whole group came together to provide support. I mean, just to give you an example of like what had formed in that group around, so I think because of that, we also were willing to take risks with each other that maybe we would not have if we were sort of more like strangers, you know?
Thank you.
Awesome. Well, I want to unmute and give a round of applause for this amazing colloquium. I think we all really learned a lot from your models here and your approach, Dr. Freedman. So
Thank you.
With that, I want to end with an announcement. Our next colloquium is on Monday, October 3rd, and we'll have someone from here at Ohio State, Dr. Penny Pask. I think that's how you say it, Pask, Director of Qualitative Methods in the Qual Lab in the College of Education and Human Ecology. And her research addresses the complexities in qualitative inquiry. So just such a nice follow-up here to this seminar. Inequities and equities in higher education and disconnections between higher education and society. And so definitely will be an amazing colloquium as well. And we'll look forward to seeing you all there.